Hello and welcome to Omnia Health Insights. Today we are joined by Dr. Robin, who is at Arab Health, and we're going to talk a lot about telehealth and the innovations transforming the industry. Thank you so much for joining us today, Dr. Robin. So to start off the conversation, can you tell me, is telehealth here to stay, and is it going to become a strong pillar of healthcare?
Yes, so telehealth is here to stay. It actually started now maybe 10 years ago, let's say, first decade, 2010 until 2020. And we had this COVID event that everyone know about now, which act as an international trigger for telehealth. All around the world, we've seen increased uptake of telehealth. Now the question is, how do we make it sustainable? How do we increase it, improve it, and make it a daily normal care and prevention activity all around the world, not just in a few countries.
So how do we do it?
Yes, so there are different approach to this. The first point to consider is to reverse the way we think about telehealth. Until now, we mainly thought about telehealth as an addition to standard physical care. So we had physical care, then telehealth came on top, and we said, okay, maybe is it better? Is it less good? Is it safe or not? Now, actually, with the increase in uptake that we've seen, the way to think about it, I think, is to think telehealth as potentially the standard itself. Okay. Meaning that to improve it and to make it sustainable, the future that we see is actually telehealth first.
Okay.
Because it is more convenient for everyone, it's more effective in timing, and it's allowing better management. So at each point of the patient pathway, whether it's for initial consultation, for a follow-up, for remote monitoring, all of this can be potentially, if it's done well, telehealth first. This means as well that we need to scale now. So during this past year, we have seen that countries like France, like India, like UAE, USA, countries in Africa as well, in China, everywhere, we had increase in volume of activity. But then after that, we saw that progressively it went a little bit down. So the question is now, how do we make it scaled as really massive scale and also sustained? For this, there is two main points that maybe we need to consider. The first being to have regulations that allow those activities to grow without any gaps. And the second one is that country needs to define their strategy. Because otherwise we see that it goes different ways. It creates issues. However, countries which define the national strategy allowed to drive the energy in one direction. Okay. And this, for me, are also the priorities that government and health authorities should take for the next months and years.
Great. So in your opinion, how is artificial intelligence driving telehealth?
So we see telehealth and artificial intelligence as two different topics for now. And often this question comes, how the both topics relate to each other. And we can see that actually both are impacting each other. For example, for telehealth, once we have established distance with patient and the doctor or between different healthcare professionals, and we have the process, then we can input any artificial intelligence component in between.
Okay.
So now we're seeing this in the field of radiology. So in teleradiology, we have outsourced radiology. Now we see that we have AI component coming into it to help for it. In the other way around, we have also standalone AI activities, which then drive to push the telehealth activities. So both should be considered as two faces, as the same drive toward healthcare efficiency and improvement of patient care. Nevertheless, they both need the same digital infrastructure, regulation infrastructure to be able to collect the data, share the data, analyze and use those data. So they're both, I think, for a while will grow in a separate field, more or less, but it's starting to be integrated now, whether it's patient questionnaire, algorithm in remote patient monitoring, automated alerts. All of this is coming now.
Amazing. So the future looks very tech savvy.
Yes.
Great. So, you mentioned earlier that due to COVID, there was an increase in telemedicine and telehealth, and people were, opting more for it. But now that things are starting to open up, there is a little bit of a gap. So what can be done to, ensure telehealth is the preference for patients?
So we've seen, again, all this time that it was driven by mostly doctors and other healthcare professionals. However, we have seen as well some resistance from doctors and other healthcare professionals. However, in scientific literature, from majority of the studies that have been well conducted and published, we've seen that the patient most of the time prefers to have some kind of telehealth component within the patient care. Why? Because it's convenient for them, it helps, all those advantages. Now the question is, what if a patient wants to have a telehealth service or have a health service and there is no telehealth service for that? How do we go forward? So my advice for companies, startups, healthcare providers is to think not from their own perspective. I have a cardiology unit. Okay, we're waiting for patient to come and then we'll do it. No, we have to think the other way around. I'm a patient. I have a chest pain. Okay, what should I do? And then from this point, then we can actually design all telehealth services that will fit to the patient's preferences. In addition to this point, it's very important to measure patient satisfaction on different types of models, because telehealth encompasses a lot of different models, different activities, and it's very important to measure what is actually preferred, because most of the time actually we found that what we thought was the preferred way was not necessarily in reality their own preference. So this is ongoing work and a strong focus for next months.
Great. So you said something very interesting about doctors not willing to adopt this technology. So what can doctors do today to become more technology friendly, if I may say, and how can it be made easier for them, because they already have so many things to do? So to incorporate something like telehealth eats up their time. So what is your advice or your opinion on this?
Yes, so for this topic, which is maybe one of the most important, there are two different settings to consider. The first one is training, which is the most important. Telehealth clinical approach needs to be integrated within healthcare training curriculum for all healthcare professionals. In France, for example, in the past years, this telehealth training, what is telehealth, how to use it, how to do it, how to do a clinical exam, all of this has been integrated within the initial curriculum, but only for medical doctors. So we are pushing to include it for all healthcare professionals, and as well for continuous training, to have all the doctors continuously trained in this regard. But for the training, we have to consider two things. There is the training on how to use telehealth and when telehealth would be necessary or not necessary, and how to use it. And then there is all the, I would say, digital semiology or remote clinical exam that is just starting. For example, how to do a throat exam through a smartphone in a video consultation. How to assess the heart rhythm remotely. Should we use a watch? Should we trust the watch? Should we ask the patient to measure it themselves? How should we do all of this? And the same way that we learned in medical school how to use a stethoscope, how to use how to read an X-ray, how to ask patients about symptoms, we need to consider all of these methods that were learned in past hundreds years of research and medical science around the world. Now, how do we do that digitally to be good in this regard?
Amazing. So are we there yet? Like, do you think, like you said, doing an exam on a video call, what are the challenges that this might pose, and what can be done to improve that?
So what we have to consider is that this is happening now, as right now as we're speaking, all around the world, doctors, nurses, physiotherapists, psychologists are doing their work online through telehealth. So what we have to consider is how to promote quality, how to promote research and evaluation. It's not just, okay, we're doing it, but is it actually better? In what way we can make it better? And also how to make it the best friendly for the users. So a lot of startups are working on how to have the best user interface, user experience, in-app pathway, and all of this. We need to think like this as national approach as well. What is the best user interface, the best user approach for having this going forward? And one example for that is in Dubai, the DHA app, which is the Doctor for Every Citizen platform, which can be directly used from the app. Is one of a great example, local example about this. Another example I would like to mention as well is the way we think healthcare funding. So the growth of telehealth will definitely impact how healthcare is being funded. Today we're in a model mostly around the world of fee-for-service. I go to the doctor, I pay, or the insurance pays for it each time. But with telehealth, this can be much better because actually we don't necessarily need to go to doctor or healthcare provider just once in a while. Maybe this was built because this was the only choice we had. But actually when we think about it every day, maybe we need to ask a question, small question every day or every week or regularly, and we want to have a direct answer. We don't want to wait 1 week, 1 month to wait to have the answer. So this means as well that maybe the funding model will go to more subscription-based model instead of fee-for-service. And when we come to that stage, and some startups have already started, this will be a huge disruption as well.
Yeah.
So many things are to come on this topic. Many work in different areas, whether it's regulations, policy, research and evaluation, training, data management, user friendliness. All of those topics needs to be tackled all around the world and go forward to make it a reality for everyone without with equity, so that everyone can access it, whether you are living in Paris in a nice area or in another area where internet is limited or the funding is limited. This needs to be an equal right to health, and a strong point for universal healthcare. Universal healthcare cannot happen without telehealth.
Yeah, brilliant. So, you know, telemedicine has also helped people with mental health problems combat their tough times they're facing due to COVID. So, what are your thoughts on that? Like, what impact has telemedicine had on COVID, on mental health?
So, the topic of telehealth and mental health is a very interesting one. Firstly, because it was one of the first applications back in the previous century in USA. This was one of the first cases that were used. Why? Because in medical specialty of psychiatry and psychology, there is less need for clinical physical exam. So this is one of the first use. However, with time, it slowly reduced and was less of a focus. Maybe because the funding model was not so attractive as well. And I actually presented about it in the last European Public Health Congress on this topic, telemedicine and mental health. And we made a review of what was existing on this topic already last year. And what we have seen is that firstly there was also sharp increase, but also a shift in the way the service was provided. We have definitely video consultation, online appointment, all of this. But for mental health, we also see that the video consultation is maybe not enough. What we need is something more broad support from, it can be from someone real, doctor, it can be a psychologist, but also it could be some kind of automated services or AI services that is coaching us on how to better hold and decrease our mental burden. Definitely this is a focus. This has to be done and provided, and again finding the adapted model, whether it is within the healthcare system now or is it something new. We have to collectively think what we want as well for this as a society.
Amazing. So it ties up nicely with how AI and telehealth are going to work together.
Exactly.
Great. So to conclude, what in your opinion does the future look like for telehealth?
It's a bright future, very bright future. We don't know what will happen. We can foresee a little bit, have some estimation of what will change. But even in the most advanced country on telehealth in North America, Western Europe, maybe China as well, the level of implemented activities is still not in a level that is a drastic change in the system. So we can just envision what will happen next, but many things that we don't know yet will happen as well. And we need to put the layer on so that then the new activities, new startups, new services new ideas can emerge. If we don't have this layer, it will not promote those new services. So we have to encourage this, make this happen, and promote as fast as we can the development of telehealth services within the healthcare system, maybe in parallel to healthcare system, but always thinking about patient first, patient needs first, population health needs first, and then going forward in this case. But I'm very positive. Now it cannot go back again, it will only grow up, but we need to collectively act upon it.
Amazing. Thank you so much for your wonderful insights today, and thank you so much for joining us.
Thank you. You're welcome.